Welcome to the 2021 Special Enrollment Period with Community Health Choice. My name is Aaron and I'm with Community Health Choice, and I wanted to show you how quick and easy it is to apply in a Community Health Choice plan, either as a new member or how to re-enroll as an existing member. Either way, the steps are the same and the process will take anywhere from 20 to 30 minutes to complete, depending on how much information you've reviewed beforehand and whether or not you have any questions. No matter whether you're new or existing, you want to do this now to take advantage of the special enrollment period made possible through the American Rescue Plan of 2021. This special enrollment period lasts until August 15th of 2021, and the main thing you need to know about it is that you stand to save more than ever on your healthcare premium throughout the rest of 2021. When you find yourself at this landing page for our enrollment period, you'll also find some very useful information, including basic terms like copayment, coinsurance, deductible, and out-of-pocket that will help you decide the best health plan for you. In addition, we have frequently asked questions from members like you, and if at any point you find yourself with further questions, all you have to do is click the phone icon on the bottom right hand of the screen. Existing Community Health Choice members can reapply and re-enroll in their existing plan now, or take this opportunity to shop for a new plan and provide updated information to Community Health Choice in order to find out how you can save the most on your healthcare premium and qualify for subsidies. To get started, all you have to do is enter in your zip code, which should automatically populate the county, or select the county from the drop-down menu, and that will help you start to shop for plans in your area. After we enter in our zip code, we'll start to answer a few basic questions about ourselves that will come into play later on in the application. This will help Community start to narrow down the plans that fit best for me and that will allow me to save the most. We'll revisit a lot of this information later on, but for now, one of the most important decisions we'll make about our plan is our effective date. Now, I'm applying for myself today because I want to start saving as soon as possible. That means I'm going to choose the next available effective date for me. I see that I qualify for on-the-market plans, which are federally subsidized. I already see that by entering in the basic information up to this point, I can see an estimated savings of up to $244 a month on my healthcare premium. That's big, and so I want to start shopping now and start to narrow down which plans I can qualify for and get covered as soon as possible with these enormous savings. Some of the information I'll want to have available include my preferred doctor and any prescriptions that I take. This will help me make sure that any plan that I choose not only has a doctor that I feel comfortable with, but covers some of the prescriptions that I take most often. I've started by entering in my primary care doctor's name, and hooray, he's covered under Community Health Choices Network. I'm also going to put in a prescription that I take frequently. Like many of us, I have asthma, and so I want to make sure that my albuterol inhaler is covered. Yay! My albuterol is covered as well. Having entered in that information, I am seeing plans that have my doctor in network and where my prescription is covered. Now, I had already done a little bit of homework in advance and narrowed down to 2 different plans. I'm going to go ahead and compare those plans one more time. I think it'd be very useful to see the deductible, out-of-pocket, and some of the copays and coinsurance stacked side by side again. As I compare these 2 plans side by side, I notice that since the monthly premium is different, then my savings are different. As I look at other plan details, I see some similarities and some differences. While the out-of-pocket is the same, the deductible is different, as well as the copay and coinsurance for certain covered services. As you're following me along as I select my plan, you'll want to remember that everyone's premium quote is different, and that means everyone's tax credit savings are also different. For now, having reviewed this information and looking at my premium and savings, I'm ready to enroll in this gold plan. This is another part of the application process that will look a little different for everyone. Whether you know your existing Softheon login or need to create an account, you'll need to do this in order to proceed with the application. Now, I am officially in the application. Throughout this entire process, I want to make sure that I review every single disclaimer and read every question in detail. Now, I've had the opportunity to review all of this information beforehand, and so I may move pretty quickly. However, if you're applying for the first time or it's been a while since you've enrolled in a Community Health Choice plan, you want to read every disclaimer, pop-up, question, and help tip in detail. Lots of the information I've entered before will come back into play. You'll notice that I entered in my zip code earlier on, and so the state is already selected here. Since we're applying for the special enrollment period, then the year is also entered. You'll notice that on the left-hand side, there is a progress bar showing where we are in the application. This is also how we can tell what information we'll need to have available next in the application process. In addition to entering in accurate information about myself, I will also need to verify my identity by answering some questions based on public records and records reported by credit agencies. Yay, my identity has been verified, so I can proceed with the application. No existing application was found because I actually have never signed up for a community health plan before. And so I'm going to go ahead and start a new application for myself. At this point, I'll start to enter even more information about myself and anyone in my household who may or may not be applying for health coverage at this time. In addition to providing additional contact information and personal details, I will also have the opportunity to select some preferences about how I'd like community to engage with me. I'll be asked what my preferred language is, both for oral communication and written communication, and I'll have the opportunity to select whether or not I would like online correspondence or correspondence by mail. Notice here that I have the opportunity to start to add anyone else who will be seeking coverage as part of my application process. This would include any dependents that I have, or if I have a spouse, a covered spouse as well. Another important question I'll have to answer at the next screen is whether or not I am getting any help completing this application, or if I'm completing this application on behalf of someone else. I'm also going to answer a very important question about whether or not I would like to see if I qualify for additional subsidies or assistance. I want to be sure and answer these questions as accurately as possible. It's also very important to note that all of the information I'm entering is for the 2021 tax year. I'll want to answer questions in the same way I intend to respond in my 2021 federal tax return. If you're in doubt, ask either community or a tax professional. Remember that some of these steps may look a little different for you than they do for me, because I'm the only person applying for coverage in my household, and I file my tax return as a single person with no dependents. After entering in all of my tax information, I'm going to answer even more details about my household, including some demographic information about myself. Remember that all of our answers vary, and so again, you'll want to read every question in great detail. At this point, I'll also be asked to answer some demographic information. While all of this is entirely optional, we encourage completing it. It lets community and the federal government know just a little bit more about who needs and is applying for healthcare coverage at this time. At this point, I'll also be asked questions about my citizenship status. I should keep in mind that any information that I'm entering at this point will only be used as it pertains to my application to enroll in a health plan and will not be used for any other purpose. The next few screens will walk me through some very important questions, and everyone's answers will be a little different. This is again a place where I want to make sure that I'm reading every single question in detail and answering to the best of my ability. If at any point I find myself in doubt, I know that I can always stop the application where I am, get the answers to my questions, and pick back up on my application later on. I happen to have all of the information I need and have previously reviewed all of these questions so that I feel comfortable answering them and proceeding with the application. This is the first of many opportunities that I have to review the information I've entered so far. At every point along the way, I want to re-verify all of the information that I've put in. It's a lot of stuff that we're filling out, and so it's possible that we may sometimes make mistakes here and there, but we have plenty of opportunities to catch them. At this screen, I'm going to answer detailed information about my income and my deductions. Now, there are so many different ways that I can enter in my income information. I can select not only the employment type that I have or other forms of income, but I can also enter my pay either hourly, weekly, monthly, bi-weekly, or annually. To keep things simple, I'm going to put in my annual income information. I'm also going to need to have some information about my employer ready. One piece of information that I may not have readily on hand is my employer's EIN. I can find that on last year's W-2, or I can ask HR if I need that number for my employer. In order to make sure that Community and Healthcare.gov have the most accurate information about my income, I'm also going to enter in any deductions that I qualify for. In my case, I pay student loan interest, and that's one of the deductions that I can enter in here so that my income can be adjusted. This has a pretty big impact on my eligibility for tax credits and other subsidies. Notice that at this point going forward, my income will have been adjusted taking into account any deductions that I entered. In this section, I'm entering in even more information to verify that I do want to make sure that I get the most in premium tax credits. Again, everyone's answers will be a little different, and in addition to answering questions about whether or not I'm currently enrolled in health coverage, I'll be asked about any events that may lead to the termination or change in my health coverage. At this point, I'm answering questions that specifically apply to the Special Enrollment Period through the American Rescue Plan. Again, if I'm ever in doubt about how to answer these questions, Community is always standing by. I can check with my employer's HR, or I can reach out to Healthcare.gov assistance. Wow, it looks like I'm basically done with my application. Now I'm at my application summary. This is one final opportunity for me to review all of the information that I've entered thus far and make sure that it is accurate to the best of my ability. After reviewing all of this information for accuracy, then I'm going to agree, confirm, sign, and submit. This is a big step, so please take your time to review all of the information you would have entered up to this point. As I agree, confirm, sign, and submit, this is as far as I'll take us in the application process today. What I can't show you is what will happen after I click the Sign and Submit button, which is the final step in reviewing our eligibility determination, confirming the plan that we selected before, and seeing our final premium tax credit and any additional subsidies or eligibility we have. After confirming all of that information, I will then pay my first month's premium in order for my plan to go into effect at the effective date that I had chosen at the beginning of the application. With that, I am now covered for the rest of 2021 with enormous savings through these new premium tax credits under the American Rescue Plan. I am so excited to be a community member now. Everyone, whether you're currently enrolled in a health insurance plan, not enrolled in any health insurance plan, or if you are happy with your coverage and even comfortable paying your monthly premium, should take this opportunity during the special enrollment period lasting from now until August 15th, 2021 to see how they might qualify for additional subsidies and premium tax credits.